Hi, my name is Coralia Gui, student for BC. Today is February 3rd, 2021. I'll be doing a physical assessment on my friend Jared. I'll be using a pen light, stethoscope. I'm going to be using a dull sharp item for a sensory test. And for the cranial nerve 1 olfactory, I'm going to be using coffee and cinnamon for him to smell. All right, let's start. Knock, knock. Hi, how are you, sir?
I'm good.
I'm going to be your nurse today. My name is Coral. Okay, I'm going to be doing a physical assessment. It's going to take about 15 to 20 minutes. So would you like to use the restroom before we start? Okay, perfect. I'm going to be washing my hands, okay? All right, I'm going to put gloves on. Okay, I'm just going to have to check your wristband. All right, can you please verify your first and last name?
Jared James, August 22nd.
Date of birth? Okay, perfect, thank you. I see you don't have any allergy bracelets. Are you allergic to anything?
No, ma'am.
Okay. All right, so tell me, Jared, do you know what is today's date?
It's February 3rd, 2021.
Okay, do you know where you are?
I'm in Nova Hospital.
Do you know who's our president?
Joe Biden.
All right. Can you tell me what you ate for breakfast?
Chicken and waffles.
Okay. Can you tell me what year did you graduate?
2005.
Okay. All right. Before we start, ask you a few more questions. What would you do if the building goes on fire?
I'd get out.
Okay. And repeat after me. Can teach new tricks. Can teach an old dog new tricks.
Can teach an old dog new tricks.
Okay. Thank you. All right. Do you mind if I assess your head?
No, go ahead.
Okay. Do you mind if I remove your
No, I got you. I'll do it.
your hat? Okay. All right. So first we're gonna assess your head. Have you had any head injuries, any surgeries? No. Okay. Head looks midline. Skin looks. Hair looks evenly distributed. I don't see any bruises, cuts, any blood on the skin. I don't see any alopecia, tuberculosis. Okay, your head looks fine. All right, thank you. I'm gonna remove my gloves. I'm gonna be putting new gloves on so we can move on with the assessment. I'm gonna be assessing your face now. Is that okay?
That's fine.
All right. First, I'm gonna start with your nose. Have you ever had a nose injury? Any surgery?
No.
Okay.
No problem smelling.
No problem smelling. Okay, perfect. Skin looks evenly distributed. I don't see any discoloration. All right. Let me get my pen light. All right. I'm gonna assess your nose. I don't see any cuts, bruises, bleeding, or any discharge. Okay, looks fine. I'm gonna give you something to smell, all right? And you're gonna let me know what you're smelling. I'm gonna have you close your eyes and close one of your nostrils. Okay, perfect. Let's start with this one. Smell it.
Coffee.
All right, perfect. Try the other side. Smell.
Cinnamon.
All right, doing great. Okay. I'm gonna be assessing your eyes. Are you wearing glasses by any chance? No. Okay. I'm gonna do a quick test for your vision. Can you read this?
Corral.
Okay, perfect. Are you able to read the sign over there?
It says exit.
Okay, perfect. I'm gonna flash the light to your eyes, okay? So I'm gonna have you look straight. And we're gonna assess. 1, 2, 1, 2. Okay, perfect. You're doing great. Okay, I'm gonna assess your sclera and conjunctiva, pink and moist. I don't see any yellowing. Okay. I'm gonna have you're gonna be looking at the pen right here. Okay, do not move your head, only your eyes. Just follow the pen. Perfect. Okay. Follow the pen. Perfect. Okay. All right. We're gonna continue. I'm gonna assess your skin. It's warm to touch. Facial hair evenly distributed. I don't see any cuts, bruises, bleeding, or any kind of discharge. Okay. I'm gonna have you close your eyes. I'm gonna touch your face. You're gonna let me know where am I touching.
Top right.
Okay. Is it left, right?
Right.
Okay.
Bottom chin.
Okay. Is there left, right?
Left.
Okay. Thank you.
Left cheek.
Okay. Perfect.
Right cheek.
All right. Thank you. Okay. I'm gonna have you raise your eyebrows. Okay. Can you close your eyes? All right. Can you try to open it with my resistance? Okay. Perfect. All right. I'm gonna have you smile, frown. Okay. Blow your cheeks. Perfect. All right. I'm gonna be assessing. See, I'm gonna have you open your mouth, clench your teeth. Okay, you feeling any pain or discomfort? No. Okay. All right. I'm gonna be assessing your ears. Okay. Have you had any surgery? Any hearing problems? No. Okay. I'm gonna look for any discharge. I'm gonna look for any excessive cerumen, any bleeding, cuts, bruises. Do you feel any kind of pain when I touch?
Okay.
If I pull here?
Okay.
No? Okay. I'm gonna assess the other side. Looks great. Any pain over here? Okay. Perfect. I'm gonna do a hearing test. Okay. I'm gonna have you cover your ear. I'm gonna test this one first. I'm gonna whisper a word and just repeat after me.
No problem. Strawberry.
Okay. I'm gonna try the other side.
Blueberry.
All right. All right, you're doing amazing. Do you have any questions so far?
No questions.
Okay.
Just doing really well.
All right. Okay, so now we're gonna assess your mouth. I'm gonna have you open your mouth. Okay, pink and moist. Everything looks intact. I don't see any dental issues. Okay. The uvula looks it's midline and rising. Perfect. Okay, can you stick your tongue out? Okay, can you move it side to side? All right. I'm gonna put my finger against your cheek and you go against it to feel force. Okay, perfect. Let's try the other side. Okay, perfect. Do you have any taste problems with salt, sweet, sour, bitter? No. Okay. I'm gonna have to take your mask if it's okay.
That's fine.
Okay. I'm gonna be assessing. Oh, yeah. Can you say ah for me? Okay. That's good. Can you stink your Can you stick your tongue out? Okay, perfect. Can you swallow saliva? Okay. All right. Okay. Can you shrug your shoulders? You can move it up and down. Okay. I'm gonna put my hands. Can you do it with force? Okay. All right. It's amazing. All right. Cranial nerves are intact. I'll be assessing your neck area. Okay. All right. I'm going to be assessing your skin first. Okay, skin is evenly distributed. Warm to touch. I don't see any cuts, bruises, no bleeding. All right. I'm gonna have you swallow. Okay, perfect. Trachea is midline. Okay. I'm gonna be assessing your JVD. I'm gonna have you lay possible. It's gonna be 30 to 45 degree. Perfect. Just gonna check your JVD. Okay. All right. You're doing great, sir. Thank you. Okay. I'm gonna be filling for your carotid. Okay. Here we go. Okay, strength is +2, easily palpated. I'm gonna check the other side as well. Okay. You're doing amazing. All right. Now I'm gonna be listening to your carotid sound, okay? I'm gonna be using the bell. Okay, check the other side. Okay. No bruit is noted. All right. Okay. Now I'm going to be assessing your chest area. Is that okay? All right. Any questions so far? All right. You're doing great. So first I'm going to be assessing your skin. Warm to touch. No cuts, no bruises, no bleeding. Hair is evenly distributed. Okay. I'm going to be listening to your lungs. Is that okay? All right. Okay. So first we're going to be listening to your vesicular. You can take deep breath. Thank you. Loud on inspiration. Into vesicular again. Okay. Now we're going to be listening to your brachial, okay, which is loud on expiration. Check your brachial. Okay, perfect. Now we're going to be listening to your brachial vesicular, which is equally heard on inspiration and expiration. Okay, thank you. Now we're going to be listening to your vesicular. Okay. And your vesicular. Okay, which is loud on inspiration. I'm going to have you turn around for me, sir, so I can also check your back. Okay, thank you. Okay, so I'm going to be checking for your vesicular. Okay, the vesicular, which is loud on inspiration. Then we're going to check your brachial vesicular, which is loud on expiration. Oh, it's evenly heard on inspiration and expiration. I stand corrected. Okay. And we're going to be listening to your vesicular. Perfect. Vesicular. All right. Perfect. Thank you very much. Before I move on to the heart, let me ask you a few questions. You having any respiratory issues? Any having problem breathing? No issues at all. Okay. All right. Now I'm gonna move on to your heart. Okay, is that okay if I listen to your heart? Do you have any heart issues? Any heart surgery? Pacemaker? No. Okay. All right. So let's do this. Okay. So first I'm going to be listening to right intercostal space, right sternal border, second intercostal space, which is your aortic, which is S2. Then I'm going to go to the left sternal border, second intercostal space, which is the palmatic. Then it's gonna be the left border, third intercostal space, which is the Erb's point, which is equal sound, equal S1 and 2. Then I'm gonna go to your left sternal border of fourth intercostal space, which is the tricuspid, which is S1. Then I'm gonna go left left sternal border, mid-clavicular, fifth intercostal space, which is your mitral, which is the PMI. And it's gonna be S1. We're gonna be listening for a full minute. All right. All right. Now we're gonna be moving to your abdomen. Okay. Is that okay if I look? All right. Should I take off my shirt?
Up to you. What do you?
You feel comfortable?
Yes, Papa.
Okay. I'm gonna be assessing your. Okay. I'm gonna be assessing your skin for any cuts, any bruises, bleeding. Okay. Any marks, discoloration. Okay. Hair is evenly distributed. Skin is warm to touch. Okay. Tell me, sir, have you ever had any problems in your abdomen? When was the last time you had a bowel movement?
This morning.
Okay. When was the last time you ate?
This morning.
This morning. Okay.
An hour ago.
Okay.
Yeah.
All right. Do you have any problems with your appetite? Okay. Do you have any problems going to the bathroom? No. How many times a day do you use the bathroom?
Do you bowel movement or urinate?
For bowel movement.
Maybe once, sometimes twice, sometimes
Okay. Okay. But you don't have issues going to the bathroom. Okay. All right. So, do you mind if I listen?
That's fine.
Okay. All right. So we're gonna start with your right lower quadrant. Okay. And we're gonna be listening. Okay. For bowel sounds, and we're gonna go to your right upper. Okay. We're gonna do your left upper quadrant, and we're gonna listen to your left lower quadrant. Okay. Bowel sounds are heard, and we're gonna be I think we used the bell. I'm gonna be using my bell to listen to the aortic bruit. Okay. Okay. No bruit is heard, noted. Okay. All right. Now we're gonna move Okay. Now we're gonna move to the touching part. Is it okay if I touch? Okay. All right. So I'm gonna be putting some pressure. You let me know if you feel any pain or discomfort. Okay. Any pain or discomfort?
Go ahead.
Okay. Do you feel any pain or discomfort? Okay. All right, you're doing great. All right.
Go ahead.
Now we're gonna move to the GU area. So tell me, do you have any problems using the bathroom, urinating? Okay. When was the last time you urinated?
Maybe 2 hours ago.
Okay. Do Have you ever had any surgery or any injury to that area? No? Okay. So I'm going to be assessing the skin, making sure there's no discoloration or any cuts or bruises or any bleeding. I'm going to check for any discharge and odor. I'm going to check for hair if there is any present for hair distribution. Also, have you done, do you do any self-testicular examination?
Yes.
Yes? Okay. Everything normal so far?
Everything
Okay, perfect. That is great. What else? I think that would be it for that area. Okay? Next, we're going to move to your upper extremities. Okay. So first I'm going to be assessing your skin. Okay. Warm to touch. Hair is evenly distributed. I don't see any cuts or bruises, any bleeding, any discoloration, just like stretch marks. Okay, it's normal, very normal. Okay, I'm going to be testing for any capillary refills, less than 2 seconds. Okay, that is perfect. All right. We're gonna. Do you have any mobility problems moving your arms? Okay. So we're gonna do a few exercises. Is that okay? So we're gonna do adduction, abduction. Okay, perfect. We're gonna flex. We're gonna extend. Perfect. Can you squeeze my hands? Okay, perfect. Can you put your hand, can you put force? Okay, perfect. Let's see what else we're gonna make this in. Okay. I'm gonna be palpating for your for brachial balls. Perfect. And I'm also going to be palpating down here. Okay. Perfect.
Sharpen down.
Oh yeah. Let me get my. All right. I'm going to have you close your eyes and we're going to do a sensory test, okay? So let me know where I touch you, okay? If you feel it.
It's supposed to be sharpened down.
No, but
Okay.
it's also sensory.
Okay,
said.
gotcha.
Okay. You just tell me you
Mhm.
felt it. You don't
Gotcha.
have to say what area, just
Nah.
let me know if you felt it.
Sorry, nurse. I felt it.
Okay.
Felt it.
Okay, perfect.
Felt it.
All right. All right. Now I'm going to use dull and sharp item. Okay. You have to tell me if you felt the dull part or the sharp part, okay? So close your eyes. Don't worry, I'm not going to hurt you.
Yeah.
All right.
No.
Okay.
Dull. Sharp.
Are you kidding me?
Sharp.
What? That was so like.
Sharp.
Okay.
Dull.
Okay. All right. So you did amazing.
Yeah.
There's nothing to be afraid. Don't worry. You
Right.
did amazing. Okay. Now we're gonna go down to your
Legs.
lower extremities. Okay. Hold on 1 second.
You sure you don't want me to just raise my feet?
It's okay. Gonna lower this down. Okay.
That's remove my socks.
Here we go. Okay, now we're gonna assess your legs. So first we're gonna assess the skin. It is warm to touch. Hair is evenly distributed. I don't see any cuts, bruises, Any discharge or bleeding? Okay, perfect. I'm gonna have to remove your socks, please. Thank you. We're gonna check for capillary refills. Perfect. Less than 2 seconds. Good. Okay, I'm gonna have you. You can put on your socks back on if you want.
Forgot to do the pulse.
Huh?
The pulse.
Oh, I didn't do pause it. Hold on.
You wanna do that quick?
Okay. Oh, let me fill for. Assessing for pause. Okay. Pulse are present. Easy to palpate. And strong. Okay. I'm gonna have you raise your legs and turn your feet inward. Do you feel any pain? Okay. Okay. I'm gonna have you to use strength. You
Oh,
can
let me
Yeah.
The socks are clean.
push against me for strength. Perfect. Okay, we're gonna do some exercise as well. Okay, can you bend your legs? Can you straighten them? Okay. Can you abduct, adduct? Okay. Can you flex your feet for me? Like flex and extend. Now here, this.
Oh.
Flex, extend. Perfect. The other one. Flex and extend. Okay. Good. You're doing great. Anything else? We did the Homan signs.
You didn't.
Okay. Yeah. Can I touch if you feel me?
Okay.
Okay. I'm gonna have you close your eyes. We're gonna do some sensory tests. Just let me know if you feel my touch.
I feel it. Feel it.
Okay, perfect. Now we're gonna use the dull and sharp just like we did in the arms. Let me know what you feel.
Dull. 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 Sharp. Sharp. I didn't feel that one. The sharp.
Okay. Thank you. Okay, you're doing great. Okay. All right, now I'm gonna last question. Do you have any have you had any surgery before for in your legs or any problems? Okay. Now we're gonna assess your back. I'm gonna check for the spine. It is midline. We're gonna assess the skin, warm to touch. Skin evenly distributed. I don't see any discoloration, no cuts, bruises, bleeding, or any discharge. Okay, and spine is midline. Okay. Okay, we're also gonna be checking for the AP diameter, which is less than the transverse. Okay. What else am I checking?
Skull. Just the head. The skull. And the sacral area.
Okay. Have you ever had back problems? Any injuries, surgeries to the back? No. Okay. How do I assess your skull?
Just the sacral area. Make sure there's no injuries.
Okay.
And then the sacral area.
And then we check the sacral area for any injuries.
Yeah.
Have you ever fallen, broken any? Okay. All right.
That's it.
Okay. Well, thank you so much for your time. I'm gonna take my gloves off. I'm gonna wash my hands. And do you have any questions for me? All right. Did great.
You did great.